Hi there and welcome back. So in this video we will be looking at the degenerative movement and seizure disorders. Now many of these disorders I have already covered through separate video and or they are so popular that you can find a lot of literature out there and it is not possible to cover them, comprehend them precisely in just few minutes. But this is just an attempt as we are looking at the nervous system to mention them here to give you an overview so that you can have all these details at one place. So with that being said, let's start with, in this category, the first one comes is the dementia or the Alzheimer's disease, and as many of us know that is a brain disorder marked by deterioration of mental capacity beginning in the middle age. This may develop gradually and early signs are loss of memory followed by impairment of judgment, comprehension and intellect. Anxiety, depression, emotional disturbances can occur. Just because you have anxiety or depression doesn't mean that you have dementia or Alzheimer. But when you have dementia or Alzheimer, it may lead to as a side effect that you have anxiety and depression and emotional disturbance. The clinical manifestation includes on autopsy of the brain, there is a cerebral cortex atrophy and widening of the cerebral sulci, especially in the frontal and temporal regions. So the microscopic exam would reveal plaques and neurofibrillary tangles or the bundles of fibrils in the cytoplasm of a neuron in the cerebral cortex. Now you know cerebral cortex and sulci and neuron and all that. That's why we needed to have that quick rundown of the anatomy of the nervous system. As we know that unfortunately there is not yet effective treatment when it comes to Alzheimer or dementia. That was just a quick overview, and likewise we have another disease that many of us have heard as unfortunately it happens with someone in our known context, ALS or Amyotrophic lateral sclerosis, also known as Lou Gehrig's disease. The name given was because of the famous baseball player who happened to be the victim of the disease. It happens in the adulthood and it affects more men often than women. Skeletal muscles, you feel the weakness, difficulty in swallowing and talking, dyspnea, respiratory muscles. Those are the frequently encountered symptoms that we see. Again, this is just an overview, so I'm just giving quick highlights here. Muscles atrophy, and ultimately you see the patient become quadriplegic. Unfortunately, neither the cause nor the cure. Both are unfortunately unknown, and that's where we say that this is one of the most complex systems that we have in our body. Let's move on. Many of you may have heard about seizure disorders. What is epilepsy? Sudden transient disturbance of brain function. So epilepsy is marked by abnormal recurrent firing of nerve impulses within the brain. And I'll make a couple of frequently encountered disorders here within the epilepsy. So you will see tonic-clonic seizures or the grand mal seizures characterized by sudden loss of consciousness, falling down, and then tonic contractions, stiffening of the muscles followed by clonic contractions, twitching and jerking movements of the limbs. Often these convulsions are preceded by an aura which is a peculiar sensation appearing before more definite symptoms. Dizziness, numbness, visual disturbances are all examples of aura. Another type of frequently seen seizure is called absence seizure or petit mal seizure, and they are minor form of seizure consisting of momentary clouding of consciousness and loss of contact with the environment. Medications are frequently given, administered to the patients with this disease. The Greek epilepsis means laying hold of. That's how the disease got its name, because they were having that belief that the victim is or was laid off by some mysterious force. Again, this is just an overview, so just some quick remarks. The next one here is Huntington's chorea. It's due to the degenerative changes in the cerebrum and involving bizarre, abrupt, involuntary dance-like movements. This condition begins in adulthood and results in mental decline with dance moments that is uncontrollable, and there are data to suggest that there is a genetic defect that leads to this disease, chromosome 4. The next in the category is the multiple sclerosis, and again we can have hours of discussion on each of these diseases. We are just passing through and looking at the quick overview of these diseases. Multiple sclerosis is a destruction of the myelin sheath. Now you know the myelin sheath, right? Myelin sheath on neurons in the central nervous system, and its replacement by plaques of sclerotic or the heart tissue. Demyelination prevents the conduction of nerve impulses through the axon and causes paresthesias, muscle weakness, unsteady gait, how we walk, and the paralysis. Again, the cause is unknown, no effective treatment, although immunosuppressive agents are often given with some benefit. Moving on to the next disorder would be the Myasthenia Gravis. That is a neuromuscular disorder characterized by relapsing weakness, asthenia of skeletal muscles attached to bones. Antibodies block the ability of the acetylcholine, a neurotransmitter that we reviewed when we started this reviewing this system, to transmit the nervous impulse from nerve to muscle cell, and normal muscle contraction fails to occur. Muscles on the outside of the eye are affected, as well as those of the face, tongue, and extremities. Myasthenia gravis. Immunosuppressive drug therapy may reverse symptoms, and thymectomy, that is the removal of the thyroid gland, the source of antibody producing white blood cells, is beneficial to many patients. So that's on the myasthenia gravis. Okay, now let's move on to the palsy. Palsy is the paralysis, partial or complete loss of motor function. You can have a cerebral palsy, that is a partial paralysis and lack of muscular coordination caused by damage to the cerebrum during gestation or in the perinatal period. Whereas Bell's palsy involves unilateral facial paralysis, which is due to a disorder of the facial nerve. Cause is unknown, but a complete recovery is possible in the Bell's palsy. Let's move on to the Parkinson's disease. Again, these are all the diseases where we can get into hours of discussion, but just a quick overview. Parkinson's disease is a degeneration of nerves in the brain occurring in later life, leading to tremors, weakness of muscles, and slowness of movement. This slowly progressive condition is caused by the deficiency of dopamine. That is a neurotransmitter that is made by cells in the midbrain, below the cerebrum and above the pons and medulla. That now you know. Motor disturbances include stock posture, shuffling gait, muscle stiffness or rigidity, and often a tremor of the hands. Levodopa, popularly used to treat this, okay, but that is not curative, that is just palliative to control the symptoms. And this is just a quick rundown of some of the frequently encountered but really concerning diseases as it comes to the nervous system. We'll move on with other disorders and diseases. See you soon. Take care. Bye-bye.